Public Health, presented by Munmunda Chowdhury, but she doesn't take any responsibility for the results, right? She's happy to answer all the really tough questions, though.
Thank you, Paul, and hi, everyone. So I'm Munmun from Georgia Tech, but as Paul pointed out, I'm not a co-author, and I'm presenting on behalf of my friends and current collaborators, Kiran Garimella from Aalto University, Abdulrahman Alfayad from CMU Qatar, and Ingmar Weber from Qatar Computing Research Institute. Can you hear me? Okay. Cool. So the title of this talk is Social Media Image Analysis for Public Health, and it's a note. So what I'm going to tell you is a brief overview of the findings that the authors found in this paper. So the ultimate goal of this work is to find out whether social media data could help us understand and track lifestyle diseases and health behaviors. So as you know, there's a rich body of literature now in SCI and related fields that looks at these types of data as a way to get traction on health concerns that are faced by populations. So why social media, right? It has many benefits and could be a way to get signals about what people are doing and how they're feeling at different points in the day. And this kind of data can be collected in real time with very little intrusion from people, and this can complement and supplement survey techniques which are typically used to identify these diseases, and thus provide a sort of more fine-grained temporal and spatial signal into these lifestyle disease-related experiences of people. And of course, this kind of data can span millions of individuals. But most of the work that has happened in this space so far has leveraged text. So text is very valuable, and these tweets that you have up there kind of tells you what people are eating. So you can have things like I'm eating a sandwich, and sort of using these types of tweets, you can get a sense of people's general dietary behaviors and different health conditions that are related to these type of eating habits. So there is work, especially over the last 2 years, we have seen a couple of papers at least in this space. Kilora looked at how these type of tweets could be used to identify and assess a variety of different county-level health statistics. And last year, Abar et al. Looked at analyzing these food consumption-related tweets to get an assessment of obesity patterns that are prevalent in different parts of the United States. But one recent development is the use of image-sharing platforms like Instagram. As you know, food is a phenomena on Instagram, and people are constantly sharing things about beautifully plated pictures of what they're eating, like you see on that picture. And if you do a simple search, you would notice that photos that are tagged on Instagram as hashtag food, that's like 193 million posts at that point in time when this was screenshotted, and that's much higher than other generic hashtags like travel, which are also very popular on Instagram. But one interesting element of these pictures is that they do have tags that people use to describe these foods, but they're always not very informative. So here, I think the resolution is quite poor, but some of the hashtags for this post are detox, lunch, and a couple of others. But they don't quite tell you what it is that people are eating. So as a result, it can be difficult to get a handle of the types of food that you're eating, which eventually can tell you things about lifestyle diseases and health behaviors of people. To tackle that, what the authors of this paper did is very cleverly leveraged what are known as machine-generated tags. So there are platforms like Imega.com, which, if you upload an image, would generate a set of machine-generated tags, which are automatically identified based on an underlying deep supervised learning framework, which is a recent advance in the field of computer vision. And what the papers of this author do is leverage those machine-generated tags as useful descriptors of what people are eating. So to give you an example, here, for the same post that we saw earlier, you can use machine-generated tags to understand what people are eating. And you see tags like salad and vegetable, which more accurately describes the food in this bowl compared to the tags that were used by the user on their own. The other interesting part of these posts is that they have geolocated information. So essentially, on a map, you can place all of these things that people are eating, leveraging the visual and the textual content of the pictures, and this can give you a good sense of what health conditions people might be experiencing in a spatial scale. So essentially what this paper does is it predicts county-level health statistics utilizing these types of machine-generated and user-contributed information shared on social media. Specifically, one of the goals of the authors in this paper is to find out what is sort of the benefit of using these machine-generated tags. The authors have collected a data set of 200,000 Instagram food pictures and focused on the 100 most populous counties in the United States. And this is sort of a spatial distribution of the different posts that were collected through this process. Thereafter, they developed a supervised regression framework in which the goal was to predict different county-level statistics of health behaviors utilizing the Instagram data. So the dependent variables in the model were a variety of different health statistics at the county level, like obesity, drinking patterns, diabetes, and so forth. So for the purposes of this presentation, I'm going to talk about these three measures, and then I would recommend you to refer to the main paper for the other ones. The predictive features of the regression model were county demographics, which are like typical baseline features that are used by agencies like CDC to get a handle on these statistics of health. And the authors also used the user-generated tags and the machine-generated tags and tested the combinations of these. So these are the performances that the authors got, and as you can see, generally including the machine tags improves the performance of the baseline model, which is if you were to use demographics alone. So to go a little bit deeper, one of the better predictions was for excessive drinking behaviors, and as you can see, the machine-generated tags include tags like alcohol, drinks, and beverage, which is a better descriptor of that picture that you see up on the post, and therefore you're getting better traction in predicting excessive drinking behaviors when you add these machine-generated visual descriptors. So essentially what this paper tells us is that there is valuable signal to be gleaned from the visual attributes of an image, and usually adding these type of information improves the predictions that we could possibly get by utilizing demographics or text-only information alone. So I think I'm out of time, and I can take a couple of clarification questions if you have any, but if you have more substantive questions, I recommend you to reach out to the authors of this paper, and the Twitter handles are up on the slide. Thank you.
I think given our time constraint and that we don't have the authors here, we'll just go right on.